There is a strength to life in Sindh. For generations, families have drawn from the land, bound by tradition and fortitude. Life was never easy, but it was theirs. A peaceful existence amidst the vastness of the land. Then, in 2022, came the flood. A force so powerful that it destroyed lifetimes of work in just a few hours. Homes and dreams both lay shattered. Muzammil and his family, like so many others, lost everything they owned. Their fields, their cattle, and the life they had carefully built. In the days that followed, there was only silence and the heavy, unanswered question: where does hope go when everything familiar is washed away?
The government first priority was to facilitate the people, to evacuate the people to the safer places. Since the disaster was of high magnitude, in which the government required support from the different NGOs, international organizations, for which many of the organizations did provide the support to the government, and in District Ladkano as well.
Jhpiego, with support from GAVI, worked hand in hand with the government of Pakistan to provide essential services to communities cut off from medical care due to the floods. Under this project, 400 health camps were organized deep in the villages affected by the floods. For families like Muzammil's, these camps became a rare source of comfort and care, bringing hope to those who had almost lost it entirely. Muzammil is a young boy living with the unyielding effects of polio, a condition that has shaped his world in ways no child should know. His father, M. Nazir Hussain Sumro, the imam at the local mosque, carries a heavy burden of regret. The regret of not ensuring his son received the vital immunization vaccines. That decision, made years ago, has cast a long shadow over Muzammil's life, leaving him isolated in ways no father wants to witness. As Muzammil watches the world around him, he often wonders if the future will ever feel different. Had his father ensured he completed his vaccine doses, the struggles he faces today might have been prevented. The weight of the past is heavy, but in his heart there's a quiet hope. Hope that the scars of today won't define tomorrow. For Nazir, every step towards healing is a chance to rewrite the story of regret, and in his son's eyes, he sees a future still worth fighting for.
जुमे जे खुतबे बि मां जमायत खे चवंदो आहियां त इहा तव्हां महिरबानी करे पंहिंजा नंढड़ ॿारनि खे जेके 5 साल घटि उमिरि वारा आहिनि बेहतियाती न कयो, लापरवाही न कयो, इहा टुका तव्हां ज़रूरु ॿारनि खे हणायो त जीअं मुंहिंजो ॿारु मुतासिर थियो आहे तीअं जेके तव्हांजा ॿार इन शइ खां महफ़ूज़ रहनि.
With support from GAVI, Jhpiego has touched the lives of hundreds of children, ensuring they receive essential vaccinations. Through an integrated model, the program goes beyond immunization, weaving together ANC, PNC care, mental health support, and community mobilization, building healthier futures, one family at a time. In the district of Dado, Zoya stands as a source of strength and support. As a dedicated lady health visitor, she has witnessed the silent fears that haunt many mothers during their first pregnancies. In her community, the absence of medical care often turns moments of anticipation into crisis, with some mothers nearly losing their children. These experiences have left a deep impression on Zoya, fueling her resolve to bring change and ensure that no woman faces her maternal journey unprepared or alone.
असांजे ॻोठ में का बि हॉस्पिटल जी सहूलियत न हूंदी हुई। इन जे लाइ मुंहिंजो शौक़ु थियो त मां डॉक्टर थींदमि, पर मां डॉक्टर त न थी सघियमि। वरी बि मां ॾाढी महिनत कई ऐं मुंहिंजी आपी जो उन में ॾाढो हथु हुयो। उन ॾाढी महिनत कई, इन जे लाइ मां LHV थियमि। एज़ LHV मां कमु थी कयां। मूंखे कम्युनिटी में मां वेंदी आहियां, मां उन्हनि खे इम्पोर्टेंस ऑफ TD ॿुधाईंदी आहियां, ANC PNC जा डेंजर साइन ॿुधाईंदी आहिनि। मूंखे ॾाढी ख़ुशी महसूसु थींदी आहे।
She joined hands with trusted partners and witnessed remarkable changes as a guide and caregiver. In just a year, maternal health services have provided over 20,000 antenatal and 644 postnatal care sessions, distributing hygiene kits to ensure mothers and their babies stay healthy and safe.
ॿार जे वैक्सीनेशन जे हवाले सां उन्हनि खे सम्झायो आहे त बाबा ॿार खे वैक्सीनेशन कराइण खां पोइ घणनि बीमारियुनि मां तहफ़ुज़ मिली सघे थो ऐं उहो ॿार केतिरो तंदुरुस्त थी सघे थो। उन खां अलावा हमल जे दौरान औरतुनि में कहिड़ियूं ख़तरनाक बीमारियूं अची थियूं सघनि या केतिरी ख़तरे जी ॻाल्हि हूंदी आहे या हमल खां पोइ केतिरो ख़तरो हूंदो आहे, उन जे बारे में बि उन्हनि खे आगाही ॾींदा आहियूं। या नंढिड़ो ॿार आहे त उहो जेकर ॼमण खां पोइ केतिरो सिहतमंद हूंदो आहे।
Community-based organizations are now equipped to educate and guide their communities, ensuring that the transformation in maternal health reaches every mother and child. But there is more. Beyond medical complications, communities are also grappling with the psychosocial impacts of the devastating floods. Salma and Ruxana, both married in the same family in UC Tokri, Larkana, never imagined the depth of devastation that would hit them in the floods of 2022. Their homes were submerged, their animals swept away, and everything they had known was lost. The destruction was unlike anything they had ever seen. For Salma, the flood was only the beginning of her grief.
ॾाढा नुक़सान थिया असांजे बच्चनि खे। असां कॾहिं अहिड़ो ज़िंदगी में मींहुं न ॾिठोसीं जेको हाणे मींहुं उठो ऐं पोइ मींहुं बंदि थियो त वरी असांजे ॿोॾ आई, बच्चनि जा फसल लोड़े वई, असांखे पघारूं कोन्हनि के, माना असांजा माल मरी विया, असांजूं मेंहियूं मरी वियूं, ढगियूं मरी वियूं, असांजो जानी नुक़सानु ॾाढो थियो। असांजा घर किरिया, असां मस हाणी का माना पेट खे मुठियूं ॾेई असां पंहिंजा अझा ठाहिरासीं, असां ॿॿर नेठो हेठां हूंदा हुआसीं, तंबू ठाही वेठा हूंदा हुआसीं, कल नेठो हेठां हूंदा हुआसीं। असां मथां मींहुं वसंदो रहियो, असांजा बच्चा ईअं रोअंदा रहिया, असांखे ॾाढो नुक़सानु थियो।
In the aftermath of the flood, Salma faced more than just the physical toll. The true weight of the disaster was the trauma it left behind, emotions that were too heavy to put into words. She and her family had survived, but their minds were scarred. The fear, the anxiety, the uncertainty of it all, it was overwhelming. It was then that the support came in, not just to help heal physical injuries, but to address the mental scars that so often go unnoticed.
जॾहिं बि का ॿोॾ या मुसीबत ईंदी आहे त इंसान जी जिस्मानी सिहत सां गॾु ज़हनी सिहत बि मुतासिर थींदी आहे। सिहत सां लाॻापियल तमामु इदारा उन वक़्तु सिर्फ़ु जिस्मानी सिहत ते फोकस कंदा आहिनि, पर वाहिद इदारो जपाएगो पाकिस्तान आहे जंहिं जिस्मानी सिहत सां गॾु ज़हनी सिहत ते फोकस करे उन्हनि शयुनि जो जाइज़ो वठी उन्हनि खे अॻिते रिफ़र कयो। ऐं इहा जपाएगो पाकिस्तान जी ख़ासियत क़ाबिल दाद क़ाबिल तारीफ़ आहे।
The journey to recovery is not just physical but deeply emotional, and a shared commitment towards mental health has been transformative in rebuilding lives in Sindh. However, reaching these far-flung areas, often cut off by poor infrastructure, required more than just medical support. It demanded dedicated individuals like Wajid Ali. Social mobilizers like him play a critical role in bridging the gap, ensuring that life-saving resources and mental health support reach every family in need.
सोशल मोबिलाइज़ेशन लाइ असां वटि हिकिड़ो यूसीए जो जेको मंथली प्लान हूंदो आहे जेके असां फॉलो कंदा आहियूं। पहिरां असां जंहिं ॻोठ में वेंदा आहियूं उन जी डिफॉल्ट लिस्ट हूंदी आहे, असां वटि 0 लिस्ट हूंदी आहे। उन ॻोठ में वञी करे असां इन्फ्लुएंसर सां मिलंदा आहियूं, जेको असां कैंप वेन्यू सिलेक्ट कंदा आहियूं। उन खां बाद असां रिलीजन पर्सन सां मिलंदा आहियूं रिलीजन पर्सन सां मिली करे असां डोर टू डोर जेकी असांजी डिफॉल्ट लिस्ट आहे ज़ीरो लिस्ट ॿार हूंदा आहिनि उन्हनि सां मिली करे उन्हनि खे मैसेज ॾींदा आहियूं त भली तव्हांजा ॿार बिल्कुलु ठीकु हुजनि पर तव्हां सुभाणे पंहिंजे हिन टाइम कैंप ते उन ॿारनि जे डुकण वारे कार्ड सां गॾु अची असांखे जॉइन कयो ऐं ॿार खणी अचो.
The flood inspired Wajid Ali to take action. He saw his community's struggle and knew they needed someone to assist in getting resources to those who were most affected. Working as a social mobilizer, he has served as a link between his people and the assistance they desperately require, with over 1,000 health sessions conducted. Wajid and his colleagues are ensuring that no family is unaware of the life-saving resources available to them.
So Jhpiego is doing great job in providing journal OPD in villages, providing medications and providing hygienic kits and raising awareness.
This approach moves beyond individual services, forming an integrated model that addresses the complex needs of these communities. Every component, zero-dose vaccinations, antenatal care, mental health support, and community leadership mobilization works together to build strength. The impact is reflected in the numbers. Over 7,000 routine immunizations, 1,000 zero-dose children reached, 2,000 defaulted children covered, 17,000 OPD patients treated, and 2,000 mental health screenings conducted. It's a model not just focused on healing the present, but also on protecting the future of these communities.
Goal of our project was to provide network of comprehensive health services by ensuring to reaching the communities, especially unprivileged and who were affected by the flood 2022.
With a focus on building a sustainable and robust referral system through community empowerment and fostering self-awareness in health-seeking behaviour, Jhpiego, with support from GAVI, has trained local community-based organizations and youth champions to serve these communities long after the camps have ended. This isn't just relief, it's strength in action, paving the way for resilient and self-reliant communities. While many were preoccupied with their own challenges, the district health officers of Dadu, Shikarpur, Kambar, and Larkana went above and beyond for their people in their regions. Their relentless dedication made all the difference, ensuring that help reached those who needed it most.
With the involvement of the local CSOs and CBOs, their involvement and their ownership, and with the development of the robust referral mechanism, we aim to develop and establish a culture of self-seeking health behaviors so that this legacy of care remains and continues long after we are gone.
And they've been able to inoculate the children not only in the routine but also those who are missing children and the zero-dose children. They covered a lot, and particularly when we were facing the measles outbreak, they'll be very helpful, and they supported our DHIT team.
This was the first time that GAVI extended their support in immunization was integrated with mental health, nutrition, and maternal and child health. Jhpiego, who with the help of EPA Sindh, implemented this project in a very hard to reach areas of province of Sindh. So I wish such type of endeavor should continue, and there should be sustainability so that in future any kind of a disaster, whether it is earthquake or flood, the affected population should get proper healthcare services.
The flood scars are still visible in these villages, but there is also new life. Through the efforts of community-based organizations, with support from GAVI, families have been given more than healthcare. They have been given a future to reclaim. And in this resilience of each villager, we see a story of hope that will outlast any disaster.